Good afternoon, everybody. My name is Whitney Mitchell, and I'm here to do my persuasive speech on increasing the compensation for CNAs. CNAs represent an essential part of patient care team. In assisting the medical staff, CNAs not only provide physical care for patients, but also emotional and spiritual support, truly making a difference in the lives of patients and families. Despite the many challenges that they go through, CNAs are typically compensated at lower rates than any other healthcare professionals. This disparity in pay is not reflective of the level of skills, dedication, and efforts required to perform their job effectively. It is imperative that we recognize and reward hard work of the CNAs by increasing their wages. This acknowledgement will foster a more sustainable, effective, and compassionate healthcare environment. With that being said, I am a CNA myself and know the work that we CNAs go through to ensure our patients get the best care possible, along with the pay we receive for the work that is being done. That is why I'm proclaiming that CNAs deserve a significant pay increase due to the vital roles they play in patient care, the demanding nature of their work, and as well as limiting the patient to CNA ratio, ensuring each patient is well taken care of. They play an indispensable role in the healthcare system, yet they are often undervalued or underpaid. However, by increasing the wages of CNA, it can help improve the workforce and quality of work as a CNA. First, I would like to explain why CNA need increase in the wages due to the vital roles they play in the patient care and the demanding nature of their work. Despite all that they do, CNAs are not well paid. According to the Bureau of Labor Statistics, the median hourly rate for certified nurse assistants is $14.83. But in some states, which is North Carolina, they can make less than $10 an hour. As a result, the pay doesn't equate to the workload and associated pressures that comes with the job of being a CNA, which I will further expound on and discuss throughout the speech. And this is a little graph statement, like I guess for somebody coming in as a CNA less than 1 year, they'll make from $15,000 to $35,000 annually. And then 1 to 4 years, they're showing $13,000 to $36,000. The low end to the high end. And then I'm gonna skip on down to 20 years or more. That's when you can start making $18,000 to $43,000. And okay, so CNAs are the backbone of out-of-home care, elder care, but they're not paid well. The profession itself is challenging and hazardous and has limited advancement opportunities, leading to chronic turnovers and staffing shortages. CNA provides some of the most basic yet crucial services to the medical patients. Without CNAs, a hospital, a skilled nursing facility, or retirement home simply will not be able to function. Here's a geriatric list. Geriatric list of the work responsibilities of CNA fulfilled. And when we say geriatric. No. Like a basic list. Basic list of what they do. Generic. Okay, I said it right?
Yes.
Okay, generic. This means that each different medical setting there is undoubtedly more than they do, specific to their work environment. And here's like a few of the responsibilities or duties they do. Like they can feed or assist with feeding patients, turn in or rearrange the patient to prevent any relief of bed sores. They bathe the residents, clean and tidy up the patient rooms, transport or assist with transportation of patients. And they respond to the patient call lights, or they can stop medical supplies for the patient rooms. Okay, and many CNAs reach a breaking point or burnouts. They report verbal abuse and lack of respect or appreciation as some of the top concerns. Economic factors have put further pressure on CNAs, causing many to leave for other industries or others to become a higher paid travel nurse, which may also be disruptive in the industry. According to another article, burnouts and exhaustion, I can't say it right, exhaustions, and lack of respect from leadership are the second and third biggest challenges, respectfully, for CNAs. Respondents also report the following data about the number of patients they must care for during their shift over the past 4 weeks. 35% of those who work either the first, second, or third shift care for between 15 to 20 patients/residents. 18% of those who work 1 or 3 shifts care for 25 or more. 30% of those who work either first or second shift care for 15 or 20 patients. 32 of those who work in the first or either second shift cares for 10 to 15 patients. 34% of those working third shift care for 15 to 20 residents. Now that we have taken a brief look into the work responsibilities of a CNA, we can now examine ways to initiate change towards pay increase for the CNA through unified advocacy and legislative change. I don't know my word today, but in retrospect, we all know that change won't be easy, but real change never is. However, as a society, we simply must value care workers or the individuals in the aging services sector that actually support all of us. Leaders in industry, advocates alongside CNAs should even come together to push for better pay, support, and working environment for CNAs. Specifically, maybe calling on lawmakers to create a government-funded wage increase that will move the current national average pay for CNAs higher. In order to do so, we can communicate concerns directly to the supervisors, gather support from fellow CNAs, research industry standards for CNAs' wages, document the workloads and accomplishments, highlight the importance of your role in the patient care, and also considering joining a union and engaging with local policymakers to advocate for legislative changes that could improve CNA pay. Essentially present a unit front with concrete evidence of the value CNA brings to the facility and the impact of low wages on the patient care quality. The pay increase will not only provide fair compensation, but also help attract more individuals into this profession, which will reduce the high turnover rate. And according to an article, fair wages for CNA can lead to reduced turnover rates, which are costly for healthcare facilities. High turnovers not only disrupt patient care, but also incur expenses related to recruiting, hiring, and training new staffs. Dang, I'm all up day. By investing in CNAs through better wages, healthcare facilities can ensure a more stable and experienced workforce, ultimately leading to cost saving and improved patient care. Moreover, higher pay can elevate the professional status, attracting a more diverse pool of candidates who may have otherwise overlooked the role due to financial constraints. This can lead to a richer, more skilled workforce that enhance the overall quality care provided across the board. In conclusion, the call for higher pay for CNAs is not just about fairness, it's about recognizing the profound impact they have on patient care and the healthcare system as a whole. Therefore, it is clear they deserve a significant pay increase due to the vital roles they play in patient care, the demanding nature of their work, and the need to ensure a manageable patient-to-CNA ratio. By acknowledging and addressing the compensation disparity faced by CNAs, we can improve the quality of care provided to the patients, reduce burnouts and turnover rates among CNAs, and create a more sustainable and effective healthcare system. That's why I urge you all to consider the invaluable constitution. I cannot say it. I was just giving it a CNA's. No,
Contribution.
Oh, did you say earlier?
Contribution.
I can't say what's up my heart then. Contribution of CNAs and advocate for policies that ensure that they receive fair and adequate compensation. I think it's time we recognize and reward the hard work and dedication of CNAs who tirelessly care for our most vulnerable population. Yeah, I mean, that's